I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. I have an incredible guest today with an incredible story that I want you to hear. His name is Adam White with TruFit. Welcome, Adam.
Hi, thanks for having me.
So Adam, tell us about what you do related to health and wellness for people with intellectual and developmental disabilities.
Right. So TruFit is the company my brother and I founded, and the goal for us is to create software that provides adaptive and effective health and wellness solutions for people with intellectual, developmental, and physical disabilities.
So let's go into that a little bit more. So what does this actually look like? How does it work?
Right. So on an individual level, so if say an adaptive athlete with a disability is using the app on their own, they can basically dial in the app to work exclusively for them. So it can customize the exercise library based on, and basically you go into their profile, they check a few boxes that, are that are sort of their characteristics, right? So maybe you have someone in a wheelchair, so they would select seated adaptive. And with that selection, that triggers the filtering system in the exercise library to remove exercises that are not adaptable to them. So it gives them a sort of a library of exercises and activities that then they can do, right? We can start them from success from day one.
Okay, that's pretty neat. So it kind of gives the person a tailored list of, like you said, activities or exercises that they can do to improve their physical fitness, right?
Right. Well, physical fitness, also emotional wellness. We have meditation, mindfulness exercises, adaptive yoga. We also offer dance. We offer martial arts instruction. And then we're about to build in life skills. So we're building in the life skills that we've been working with some assisted living homes, and we talk to them and some of their needs. And what we've done is identify some of those needs in terms of life skills and things like making your bed, how to safely boil water, how to tie shoes, different things like that are needed in this community. And what we're going to be doing is building that into the library as well. And we hope to expand that. We're also building in a nutritional component of the app to teach and sort of motivate individuals to sort of adopt a more, nutrition focused lifestyle and diet.
So it's really a whole person health kind of
Absolutely,
app.
Yeah. It started out as the idea for fitness, and as we worked with the community and identified their needs, based on the platform that we created, we created a way that we could expand this into many different areas. And so we, with those needs being identified, we said, let's address these. Let's bring some solutions to that. So we've evolved from an adaptive fitness program to an adaptive health and wellness program that's much more sort of holistic in nature. And then on top of that, we have a social network that's built in. So that social network allows for that athlete to find support. That might be support through a coach that we provide at TruFit, or we can also facilitate the creation of groups or clubs with nonprofit organizations, or in a school setting where we have an adaptive physical education program with a curriculum that they can create a classroom setting within the app and connect the students and the teachers and even parents. And now they have an adaptive physical education program that a school can provide to their special education students.
So you started off saying that, how an individual can use this, and now we're talking about schools, and I believe I know you've done some work in kind of starting to pilot this program, right? So talk about how a school can use this program.
Right. So, one of the big things that schools have just really never been able to create is an effective adaptive physical education program for their special education students. As we built this program out and built the platform for the software, we realized that we could apply it into a school setting. So what we did was we brought in a curriculum development specialist and worked with my brother with the program. They've developed a really comprehensive, national standard, setting, adaptive PE curriculum for teachers and faculty. And what we're getting ready to do coming into the 24-25 school year is we're going to be piloting this with schools throughout the country, and looking at how does the software work in conjunction with the curriculum in that classroom setting. And what we're going to be doing, following this pilot with schools, is selling this to schools as sort of a package. And it's a way for, eventually what we're looking at is a turnkey solution for schools to be able to provide their special education students with an actual physical education program that's beneficial to them.
What happens now in people that are in special education when it comes to physical activity, physical exercise? What happens now?
So if a school has any kind of adaptive PE program, typically it's pretty minimal. It's a floating PE teacher that might have some experience in, working with special education students. They, in a district, they might float around to different schools once a week and spend an hour with those students. So if you have that, which is about what most schools have, you're getting 1 hour a week of PE, maybe two, and many schools that I've talked to, and many of them that have signed up in this pilot that we're getting ready to do, they don't have any adaptive physical education program, right? And that's the experience that I had growing up in Louisiana. My public middle school that I went to, they didn't have an adaptive PE program. In fact, I was in the PE class where the special education students went, and they would sit on the sideline. They didn't play basketball with us. They didn't do any of the sports or anything with us. They just showed up and they sat there and they got participation points.
Not very inclusive, is it?
Not inclusive, and there's no benefit for that student, right?
Right.
Just because you're in a motorized wheelchair with cerebral palsy does not mean that you can't do something, right? It's just a matter of identifying what you can do and see what can help improve your health and wellness and physical education and applying that. And I get it. There's a lot of budgetary limitations and things like that, especially in public schools. So what we wanted to do is create something that was affordable for the schools, effective for the students, and also a method of engagement with teachers to make it easier for them to be able to create these programs and do that. And I think we're on to something. We're gonna bring it out to schools. We have quite a bit of schools throughout the country right now signed up on the pilot. K through 12, as well as universities and colleges that are getting ready to test this out starting in July.
Well, that makes a lot of sense to me. I mean, the easier you can make it to help, say, a PE teacher be able to develop a curriculum or a program that can help a person with any level of disability, that to have something to be physically active that's tailored to what they can do is fantastic.
Yeah.
So that's excellent. So what else is happening in the TruFit world? What else are you looking towards in the future?
Oh man, so much. So we've got, right now we're also, working with nonprofit organizations. So the same software can be taken and applied into an organization, say like the Arc of San Diego. And what we're able to do with a nonprofit organization like that is we give them a solution and an opportunity to offer a health and wellness focused day or recreation program to their members. So we've been working with the Arc of San Diego for quite some time, and we have, organizations throughout the country that we're doing that with. What we're getting ready to do with them as well is build in, and we built the platform for it, and we're getting ready to test this out. But, one of the things that nonprofits are always looking for are donations, and that's always come up in my discussions with them. But we're a small startup company. So I came up with a solution to create community with them, but then also provide financial support on the back end. So what they do is they can sign up as an affiliate organization and market and sell this program to their members. And then any members that sign up through that organization's unique link, they then earn a residual commission on the back end for the life of that active paid subscription.
Wow.
So we give them community. We help them build that community and set up a fitness club or a group in the app for their members. And then on the back end, they can earn some revenue to help support their mission. For us, community, it's like the most important word here. It's like the word of the year every year for me in terms of how we focus and build this company to support them. And we have to support the nonprofits, right? We have to support the teachers. We have to support the parents. and anyone else who sort of surrounds that individual with a disability and supports them in their average day. So that's what we're aiming to achieve, is sort of a not just supporting the athlete, the adaptive athlete, but supporting that entire community that supports him or her as well.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So this sounds like something that would be great for provider organizations of like residential provider programs or day service programs to tap into what you have to be able to enhance what they offer already in terms of physical fitness. And am I thinking correctly here?
Exactly. Yeah. In fact, we have a couple assisted living home organizations already signed up for the pilot. We have Autism Services of Southwest Louisiana and Lake Charles. They have 4 residential homes, all with autism residents that, have assisted living, in these homes. They just signed up for the pilot, and we're going to be going to Lake Charles and working with them to onboard their athletes, create a group at each of the homes. And then those service providers there will be working with those residents to improve their health and wellness. So we can really apply this program into many different sort of environments within this community. Another one being medical providers with physical and occupational therapy, as well as ABA therapy.
Talk more about that.
Yeah, absolutely. Yeah. So we actually have, and this sort of happened organically, which was interesting. And we had always sort of thought about it, but we weren't really sure how it would work. And so what we're doing is we've identified a few OTs and PTs that have signed up in the app. We reached out to them and said, hey, we appreciate you signing up on the app as a coach. What do you see as this opportunity? What are you doing with this? And what they told us was, the average physical therapist, they get to see their patient once a week for an hour, right? I mean, that's, maybe you're working with a cerebral palsy patient who, working on, mitigating muscular spasticity or something along those lines, or maybe mobility. 1 hour a week is not any good, right? But that's all the health insurance companies will pay for, right?
Yeah, just to stop you there. Yeah. I talk about this sometimes where you've got, like you said, a physical therapy program, and the person participates in it once a week. And let's say you're trying to reduce, spasticity. Well, the whole other however many hours there are in that week, the person is not physically active or doing anything and to reduce that spasticity. And that 1 hour really isn't going to do much. It's kind of like going on a diet for 1 hour a week, and then the rest of the time you eat whatever you want. It's just not really going to be that effective.
Exactly. I tell people it's like saying I'm going to change my diet and eating an apple on Sunday, but eating at McDonald's for the rest of the week.
Right, right.
Like, it's not going to do anything. Right?
So this is a way to incorporate that activity in a much broader way, and bringing in the PTs and OTs. And to talk about how that works.
Yeah. So what we discovered, what they were doing was they were creating a private group in the app, which is a secure group, right? We have ways to create private and public groups in the app. And what we did was, or noticed them doing, was they were creating a private group with their patient. And then at the end of their therapy session, they were saying, okay, look, we want you to do these 3 or 4 exercises or activities throughout the week until we meet next time, because they complement the therapy that we're working on. So they're looking at how do we expedite positive health outcomes in therapy by influencing that adaptive athlete to keep moving forward when they're not together. And if they need help, they can connect through the chat feature and different, because we have a social network in the app. So if that patient needs some assistance from their therapist, they can chat with them. So it's a very easy method of engagement for a PT or an OT to use to keep sort of, in touch with their patient throughout the week and see what they're doing. They need some help. They can reach out. They can get that help. So it's not, it's not having to go like really above and beyond in terms of time, investment for that PT or OT, because I know they're busy with other patients, but it allows them to sort of monitor what their patients are doing throughout the week. And then on top of it, we have an incentive program that we're launching on this. So that patient will be incentivized to do this because they're going to earn rewards by being consistent and participating in doing these activities in the app itself.
It sounds like a fantastic program for people that are listening that want to learn more, that want to know how to get involved or to utilize the services. What's the best way to do that?
They can go to our website, which is gettrufit.com. And they can also, reach out to me. My contact information is on the website. I'm also on LinkedIn. So there's different ways to get in touch. We're still looking for more schools, more ABA therapy, PT and OT clinics, as well as nonprofit organizations that are looking to offer their members a recreation or day program that can help improve their health and wellness.
And for Get TruFit, it's GETTRUFIT. Is that right?
Correct. Yeah. GETTRUFIT.com.
Excellent.
Yeah.
Excellent.
No E on true. Yeah.
Yeah. Okay. So one of the things I always do is something I call 3 in 3. It's 3 things in 3 minutes that you'd like the world to know, in particular in your area, in your field, that you think can improve support services, health, wellness, lives of people with intellectual and developmental disabilities. Whatever tidbits you want to bring into this conversation. So go ahead.
Okay. Well, I've been working in this space, in this market for about 4 or 5 years now. And one of the things I realized is that the disabled population is what I consider a ghost population. I think there's a lot more that needs to be done in terms of not just advocacy for rights, but also advocacy for recognition. Like the general population, if you do not have a personal connection to someone with a disability, you don't know really much of anything about it. And I'm guilty of that, right? I learned about this by going and volunteering at the ARC, when my brother was doing his classes, and that was life changing for me. Now I'm on this completely different path. So I think advocacy needs to change in terms of that. And then second would be a different approach to health and wellness. Okay. And, as a doctor, but health and wellness and health, health insurance, I don't want to call anybody out specifically, but it seems to be reactive rather than proactive. And, and what we're trying to do is take a proactive approach to improving health and wellness, right? This particular demographic has arguably the highest obesity rate in the country. They have one of the highest diabetes, cardiovascular disease rates. They have a very difficult time finding jobs and being job ready and be hireable. Those are things that we're trying to make an impact on proactively. And, I feel like a lot of what I see out there is a reactive stance to things. And I'm hoping we can change that dynamic of what we do. And, at least in health and wellness, we can spark those conversations and create a path forward to being a proactive community that is, looking for solutions before something negative happens in a way. So the third thing is sort of a disconnect between the general population, right? If you want to call it that, and the disabled population. In terms of, I notice, because we're a for-profit company, right? And what I've noticed is when we engage with general population, right, they assume we're a nonprofit. For some reason, any organization that should be helping someone with a disability should be a nonprofit. And I feel like that's sort of like, it's a stereotype that needs to be removed, right? Like,
I agree with you.
And
Yeah,
I think there's an issue with that, and I think it leads to it's a huge contributor to why this community is underserved in many ways, because with capitalism, which I capitalism is great in certain ways, but if when it comes to like for profit, if they don't see the potential, they don't want to invest, and that is a huge barrier to really effectively addressing some of the problems experienced by folks with disabilities, because you sort of get pushed into this nonprofit world, which nothing wrong with nonprofits, but there's things that you can do as a for-profit company that you cannot do as a nonprofit, and I think you can make more impact as well in many areas that you can't in a nonprofit world. And that's something I think that needs to change very, very much.
It takes resources to promote innovation and to develop new products and so on and so forth. And I get that totally. So Adam, thank you so much for sharing this information. I think it's a great product that you have, a great tool to improve health. Because we know that exercise is so tied to health and health outcomes for people with intellectual and developmental disabilities, and for all of us. So I really, I'm rooting for you guys to just take off and sail off. I hope the pilots really go great, and I would love to have you back to learn more about that at another time. Again, it's get TruFit, no E on True, GETTRUFIT.com, right?
Right. Yes.
All right. Adam, thanks so much for joining me today, and keep up the incredible work you're doing in the field.
Yeah, thanks for having me, Greg. I appreciate it.